Hi, my name is Tony Graves, and I am the Orthopedic Service Line and Rehab Director here at SRMC. Congratulations on making the decision to address your joint pain. You are about to embark on a journey that we hope will be truly life-changing and will have a positive impact on your quality of life. This presentation will give you a comprehensive overview of what to expect with joint surgery. It will last approximately 45 minutes. I will now turn this presentation over to Rita Gottschalk, our Joint Program Nurse Navigator, and we truly hope that you find this presentation to be informative, and we hope that you enjoy it as well. Have a great day.
Hello. Today I just want to go over the objectives of what we're going to discuss for your joint class. First thing is understanding your procedure, what to expect during your hospital stay, physical and occupational therapy, pain management, how to care for yourself at home, role of the caregiver, and discharge planning. We just want you to understand the procedure that you're actually going to have. You're going to have a total knee replacement or a hip replacement or a unicondylar partial knee replacement. The goal for your surgery is to remove the pain and restore function and activity so you can have a better quality of life. The actual total knee replacement procedure is removal of the damaged bone and cartilage from your thigh bone or your femur, your shin bone, your tibia, and your kneecap, which is your patella, with insertion of an artificial joint prosthesis, which you see to your right. A total hip replacement procedure is the removal of damaged bone and cartilage from your thigh bone, your femur, and your pelvic bone, your acetabulum, with insertion of an artificial joint prosthesis, which you also see to the right. A unicondylar knee replacement procedure, it only replaces half one side of the knee joint with a prosthesis instead of the whole total knee. So this joint class is to help you prepare for your surgery, and you must have received a guidebook from your pre-admission testing center, which is either for your hip or your knee. And this guidebook will help you answer questions that you may have prior to your surgery and also after your surgery. There's a pre-op checklist in there if you are notified from pre-admission testing to get any cardiac clearances, any pulmonary clearances, or even your primary care physician clearance. You want to take that page out of the pre-op, out of your guidebook, and just make sure that you have all your clearances completed prior to surgery. There's also pre-op exercises in the back of the book which you want to start working on before your surgery. These are exercises that you will be taking care of doing right after surgery, and also you will be doing these exercises right on through your recovery. And then it also addresses your hospital stay. Generally, our patients stay a one-night, overnight stay. Once they go to joint class the next day after surgery, we usually discharge you home with home health, and home health agency will come and see you at home. Also in your guidebook, there's a page that talks about caring for yourself at home. One of the biggest things is whenever you come back to our unit from surgery, we will start the process of getting you ready to go home with your oral pain medications. So we want to make sure that you're on the appropriate pain medication to manage at home. When you get home with these pain medications that help you, we want you to understand that we want you to be comfortable whenever like physical therapy from home health comes out and sees you and works with you. So if you have such an appointment at like 10:30 in the morning, we want to make sure that you're comfortable and ready for that physical therapist to work with you. So if you can take your pain medicine within 30 minutes to an hour before that therapist gets there, that is the best thing that you could do to help yourself with that. Another big thing about pain is ice. We will be sending you home with either gel packs or such with some kind of ice therapy. Whenever you have this pain, sometimes the inflammation can cause you to have discomfort. So using ice on your surgical site can help you as well. The other big thing is when you are at home and you are not working with physical therapy, you want to make sure that you level out how long you sit, how long you sleep, and how long you are up moving around. We don't want you up cleaning house too long, but we also don't want you sitting for hours without moving. We want a nice even pace throughout the day of sitting, resting, and moving around. Otherwise, you could get stiff and it can cause you to have more pain. Another big thing is when you go home, you're going to be going home with an anticoagulant therapy, which is such as maybe aspirin 325 twice a day. Or you're also going to have compression stockings on when you go home, and you'll be sent home with an extra pair. You want to make sure that you take these, therapies serious, and make sure you continue that aspirin regimen, and also make sure you're wearing those compression stockings every day. You can take them off for about an hour a day just to, give yourself a little rest. You can do it while you're showering and getting yourself ready for the day, but just make sure you put them back on. Those should be worn at least a couple of weeks until your follow-up with your surgeon, and then he or she can tell you what to do further at that point for that. Also, the big thing is make sure you understand that when you receive anesthesia, it slows your entire body down. It slows your lungs down, it slows your bowels down, it slows everything down. So to get everything kind of boosted and restarted, we want to make sure you drink plenty of fluids, and make sure you start out the process of eating slowly, maybe 5 small meals a day compared to 3 large meals a day. It also can cause a little nausea, and that can be normal, and we will hope to take care of that before you leave. And the other big thing is remember, when you're taking pain medication, it can also cause constipation. So if you do need a bowel regimen such as stool softeners or anything, just make sure that you are taking care of that as well. Discharge instructions. So whenever you are here in the hospital, you usually have an overnight stay. You will generally go to what we call a joint class around 1 o'clock, which is generally after lunch, your next day after surgery. And then usually we discharge you home as long as everything is okay with you. Resuming activities, you will start back when you get to our floor. Within 4 hours after you come into our floor, we are usually getting you up, moving you around, getting you to the bathroom, getting you to a chair, or even walking the hallway at some point if you feel okay with that. So we always guide the patient according to how they feel, but that's generally what we do. So when you come through pre-admission testing, which you will do before you come to this, before you view this class, you might want to talk to them about what kind of medical clearances you may possibly have to have before your surgery. So if you have cardiac issues, if you have congestive heart failure, if you had previous heart attacks, anything of such of going on with your heart, you may have to have some cardiac clearance before your surgery. If you have maybe some high blood pressure issues and some diabetes issues, those kinds of things, you may have to have your primary care provider clearance. So just make sure that you follow up with all of your doctors that pre-admission testing or your surgeon sends you to for clearance prior to your surgery. Also, instructions to stop or change any medications should either come from your surgeon or it will come through PAT, pre-admission testing, whenever you come in. They will inform you of what to take, what not to take. Generally, most of the time, the blood pressure medications you end up taking in the morning before surgery with a small sip of water or something. But just make sure you do follow up with those instructions from your surgeon or pre-admission testing. The day before your surgery, you want to make sure that you understand exactly what medications to take and what medications not to take. Um, Either the night before or even the morning of your surgery. You want to make sure that you understand what to take for your medications. Also, there's nothing to eat or drink after midnight, only the medications that are directed by your physician to take with a small sip of water in the morning prior to surgery is okay. Nothing to eat or drink. And if I was you, I would probably just eat a small light meal for dinner the night before. When you come through pre-admission testing, they will also give you an antimicrobial antibacterial scrub to use, and this will be something you will use prior to surgery. Follow pre-admissions testings orders. Most of the time, it's either you use it for a week before surgery, or you may just be informed to use it the night before and the morning of your surgery. And this is to help keep infection rates down. So a lot of people want to know what to bring to the hospital. Just pack a small, light bag. You don't need a whole lot. Pack your toiletries that you normally would like to use. And then when you pack your clothes, just make sure you are packing some loose fitting clothes that are not tight form fitting. Some loose shorts, some loose jogging pants, some loose pajama pants, because the nurses are going to want to get to that site and check it often. And then also before you leave here, we're going to be changing your dressing. So we want to make sure we're able to get to that site. It says battery powered items only. We do allow cell phones and bring your chargers, that's fine. But if you have like an electrical razor or anything like that, just make sure it's charged prior to bringing. We also have internet access, so you can sign up as a hospital guest wirelessly to use the internet. Any shoes or leg orthotics, so if you have any specific shoes that are assigned to you, or if you have prosthesis or anything like that, make sure you bring those with you. And when you pack your shoes, if there's nothing special to them, we want to make sure that you just bring some totally enclosed shoe types, like don't bring flip-flops, don't bring Crocs or anything like that. Just make sure you bring tennis shoes, something that will totally enclose your foot. You can bring the guidebook if you would like. It kind of just helps you with what is expected here at the hospital. Bring a medications list if you'd like. Most of the time we've gotten that already through pre-admission testing, so it's really not necessary to bring another medication list, but if you'd like, that's fine. Leave all your valuables and your cash with someone or at home. There's no reason to bring jewelry or credit cards or cash or anything of a such to the hospital. You don't want to risk the chance of losing them, and that can possibly happen the day of your surgery. So just make sure they are left at home or they are with someone safe. So the day of your surgery, you're going to report to the hospital. You're going to report to the same day surgery desk, which is located on the second floor. You can either walk up the stairs or you can run up the elevator. You will be taken to a prep room where you will be given a hospital gown, an IV will be started, and this is where you will also see your surgeon and probably your anesthesiologist as well, where they will go over the procedure with you. They will mark your surgical site with you, make sure that they are marking the appropriate surgical site, and everything is in agreement at this time. During this same day surgery process, you will also see your anesthesiologist, and they will make sure that you understand what anesthesia procedure they plan on providing for you, and you will discuss that with them. They're going to make sure that they review your health and medication history with you and ask you several questions, and they're going to probably do an assessment with you as well, and discuss surgical or medical related concerns. So if you have any concerns about anesthesia, if you've had any issues or problems with anesthesia in the past, this is when you want to definitely let the anesthesiologist know about those issues. There's two types of anesthesia. There's a spinal anesthesia, which is given at the level of the nerve root. And then there's a general anesthesia, which impacts your entire body completely and makes you completely unconscious. So you can discuss these options with your anesthesiologist at that time. Anesthesia will also go over some nerve blocks, which they do use for your, mostly for knees, but some for hips. Nerve blocks are used to block the sensation of pain in the area that surgery is being performed on during and after the surgery. They typically last several hours to 1 to 2 days post-op. They will make your limb feel numb, they will decrease the pain sensation, and may make the limb feel weaker until it has worn off. So sometimes with our patients, they will come up and the block has already worn off. Some of our patients feel the block for several hours, and sometimes our patients will feel the block until the next day. So it just depends on the patient. We can't guarantee you that it's going to work for you for 24 hours, but it just depends on the patient. So these are some other things that you can discuss with the anesthesiologist at the time when you are in same day prior to your surgery. So there's 4 different types of nerve blocks that the anesthesiologist may possibly use. One is called an adductor canal block in the knee, and it's the skin of the inner knee down to the foot. The femoral block, which is the femur and knee, it's the skin of the front of the thigh and inner leg muscles of front of the thigh. The fascia iliac, femur, and knee is the skin of the front of the thigh and the inner leg. The sciatic block femur is the leg and the foot, skin of the back of the thigh and the whole leg, muscles of back of the thigh and the whole leg. So each block will protect or actually decrease the pain in certain spots of where they put the nerve block. So after you've gone through same day and you've met up with your physician and the anesthesiologist has come through and you've gotten your IV and everything's good, when they're ready for you, they take you back to the OR room, and this is where you meet your surgical staff, which is, the whole staff that may be involved in your process. You will be on the operating table and they will situate you appropriately on the table. And then after the procedure, they will put you on our hospital bed. Surgery is generally 1.5 to 2 hours, just depends on the procedure itself. And then once surgery is completed, you're transferred to PACU, which is a recovery room. You're in PACU for approximately 30 minutes to an hour. It just depends on what you have going on that they need to stabilize. So maybe you have a blood pressure issue, or if you have some pain issues, this is where they will take care of those issues. And then, and this is where your surgeon will actually go and talk to your family and inform them of how the procedure went and what exactly he did for you. So in the recovery room, which is what we call PACU, you may be in there for approximately about an hour or so. Like I said, it just depends on you as the patient and what kind of stabilization you may need. This is where they will stabilize your vital signs, make sure that if you're having any nausea issues, they'll take care of those. If you have any pain issues, they'll start to get that under control. And they'll start doing your neuromuscular assessments, which is make sure you have pulses, make sure you can move your toes, make sure you can move your feet, your legs, and like I said, comfort measures. They will also address any pain medication that you may need. They will also address any nausea you may have at this time, and then your family will be instructed of where to meet you at this point in time. The pain scale, pain rating scales, this is a great time to take a look in your book and become very familiar with the faces. And our pain rating is 0 to 10, 0, no pain at all, to 10, which is the absolute worst pain in the world. We want to make sure that we get an accurate pain reading from you. There are some patients that come up and say, oh, my patient's a 2, when actually their patient is their pain is an 8. We don't want to dose you with pain medication. We want to make sure that you are dosed appropriately with pain medication, because remember, you're going to go home with the pain medication that we understand that works for you. So if you're telling me your pain is a 2 and your pain is an 8, you are not going to get your pain under control at that point. So we want to make sure that we understand your pain rating appropriately. So if you are an 8, you need to let us know, I am an 8, so we can make sure that we get you straight with your pain medication at that time. Pain can cause you to have sleeping discomfort. They can interrupt your conversations, and it also can interrupt mobility, which is one thing we do not want, is for it to affect you with physical therapy and getting up and moving around. We want to make sure your pain is under control. So we want to make sure that you understand the difference between pain and discomfort. You have been dealing with pain, obviously, before surgery, because you have now elected to have surgery to take care of that pain. So you know what pain is. We want to make sure that you are giving us the appropriate pain levels to pain, not just because of discomfort. Remember, you've had surgery, so all of your pain and discomfort is not going to be gone, but we definitely want to understand what kind of discomfort you're having. So at the incision site, you can have soreness, you can have some pressure, you can have some itching, which is, whenever it's starting to heal, you can have the itching. We want to know when to treat you with pain medication and when it's just discomfort. So we want to understand what exactly you're feeling. You can have swelling and bruising at the site. You can have tightness around the incision or the joint. And we also treat this not just with pain medication, but we want to treat it also with ice, compression, and elevation. We don't want you sitting in a chair dangling your legs. If you've had a knee replacement, we want to make sure that your legs are elevated, and treating it with the appropriate pain medication and also treating it with ice helps a lot. As we were just discussing with comfort measures, yes, of course, we definitely want to continue with the pain medications. We also want to continue with the compression, which is the compression stockings. And we also want to continue with the ice therapy, which is either polar ice or ice packs. And we want to make sure that you understand that changing positions or getting up and walking can also help you relieve some of that pain that you may be feeling. Sometimes you just need to get up and move and just help release some of that tension that you have in your knee or your hip. So we want to definitely make sure that we are ambulating you appropriately and make sure we're changing your position often. So you as the patient have a huge responsibility. The nurses want to understand where you are with your pain levels, because it is your responsibility to be honest about your pain levels so we can make sure that we get the appropriate regimen to you. So we want to make sure that you stay ahead of the pain. Once you get behind the 8 ball of pain, it is very hard to get back on track. So like we were talking about before, if you're rating your pain a 2 and you are already an 8, you are going to become very quickly out of control. So we want to make sure that we understand exactly where your pain rating is. For the first 48 hours, you definitely want to take your pain medication as prescribed every 4 hours. Some people are like, oh, I don't like to take pain medication. I don't like to, keep going and taking it. Well, at this point, after surgery, we definitely want you to take it for at least 2 to 3 days after your surgery to make sure that you stay under control. You can work with physical therapy and do the things that you need to do. After the 48 hours, you can kind of start to back off of it a little bit. So if it's every 4 hours prescribed, maybe take it every 6 hours and just start weaning yourself off of it. You can need to tell your nurse if the pain medication is not effective while you're here in the hospital. If you are not getting relief from what you're receiving, we need to make sure that we are addressing that issue. Here on the floor, we do not like to give IV pain medication because when you go home, you can't have IV pain medication. When you go home, you're going to go home with PO medication, which is where here in the hospital, we want to make sure that we get you on the right regimen that's going to help you. On the communication board, we will also write when the last dose you got and when the next dose will be available, so we can all stay on top of when the next time your pain medication is due. We want to ensure that you are comfortable and you can work with physical therapy and make sure you do the things that you need to do before you go home. Just remember that we cannot make the pain completely go away. You have had surgery, so that is going to be somewhat discomfortable, but we want to make sure you're not in severe pain. We want to make sure you're at a comfort level. So we aim to manage the discomfort so that you can eat, sleep, move around comfortably, and just, not make life too terrible. So like I said again, stay ahead of the pain and make sure you are rating your pain appropriately. The goal is comfort with oral pain management before you discharge. So coaches can stay. We welcome coaches to come and stay with you and be part of your recovery, be part of the joint class, so they also understand how to maneuver you around. Whenever they do stay, that we offer a coach lunch, and we want them to be part of your healing process. So this also helps you as the patient just gain some confidence for discharge to go home and know that somebody is going to be there with you and help you. So one of the pamphlets that you will receive while you're here is called the Daily Run. And these will explain to you kind of like what the process is while you're here of what kind of schedule you will be on. So we start very early here. Our night shift nurses usually will have you up around 5:30, getting you cleaned up, bathed, brush your teeth, get yourself dressed, and usually get you up to the chair. So by the time your day nurses come on around 7 o'clock in the morning, we start getting breakfast around 8 o'clock, and then you start working with physical therapy and occupational around 8:30, and just kind of have a day layout for you. So we do get started here early, and this Daily Run newsletter will help explain some of that. And just remember that you are in a program once you come to this, you elect to have these surgeries. So we will be inviting you back for group lunches, which is a great thing. We love to hear back from our patients. We want you to come and join us for the group lunches. We want to hear your feedback. We want to hear about how the hospital did for you, how the surgeons did for you, how the unit nurses did for you. And if there's anything that we can improve upon or change, we definitely want these feedbacks. So you'll be receiving in the mail some invites to a group lunch to come back and share with us. So just keep those in mind. Also, you'll be receiving in the mail surveys. You received a survey before your surgery through pre-admission testing, which gave you a rating of kind of how your comfort levels are now, or your pain levels are now before surgery. So after surgery, we also want to know 6 weeks, 12 weeks, and 6 months after your surgery, how are you feeling? How are you doing? And we are very interested on your progress after your surgery. So there are some complications that can happen after surgery, so we want to definitely prevent those post-op complications. One of the biggest things is blood clots. I think we've mentioned this before, and something called a pulmonary embolus. So whenever you go home with that aspirin regimen, or you go home informed to wear compression stockings, we definitely want you to follow through with this regimen. This will help you prevent blood clots from forming and also prevent what we call a pulmonary embolus. A pulmonary embolus is a very serious medical condition. Symptoms may include shortness of breath, chest pain, palpitations, which is your heart racing, sweating, or anxiousness. If this occurs, you need to come back to the hospital right away. You want to make sure that you get some medical help quickly. So one of those regimens that we use here at the hospital called anticoagulation therapy. Sometimes you may be put on a Coumadin therapy. You may also be put on something called Lovenox, which is usually a shot in the abdomen every morning. So generally our physicians like to use aspirin 325 twice a day. But there are a possible chance that you could be put on Coumadin or Lovenox for your anticoagulation therapy. It just depends on what your physician may want to use for you. So preventing complications also is preventing infection. So when you go through pre-surgery screening, which is through pre-admission testing, you'll get the antimicrobial skin wash. You want to make sure that you definitely are washing your skin as directed. And you want to make sure, they're going to offer you antibiotics before surgery. So that's another prophylactic use that we use here. We're going to take your vital signs and your temperature frequently, especially here on the floor after you get back from your surgery. We will be taking them very often. You want to make sure that people are hand washing, make sure you're hand washing before you touch the site. Inspect your incision often, making sure that you don't have that redness or drainage or swelling or pain at the site. You want to tell your dentist before your surgery that you're having the surgery. You want to inform, tell your doctor if you're going to have a colonoscopy or anything, just make sure you inform them. And then removal of your urinary catheter will also take place either before you leave the OR or shortly after you come to the unit. You will be having a catheter removed. So we were talking about earlier how everything kind of slows down in your body after you've had anesthesia. One thing it can cause is nausea and vomiting. If you know that this is a history in your this is a complication you have, make sure you tell the anesthesiologist so we can take care of it even before you even start with it. And then whenever you're recovering in PACU, and then when you come to the floor, sometimes it may not affect you until you come to the unit to recover. But we'll hope to have medications on board and hope to get you under control with any nausea or vomiting issues. Also, constipation. You want to make sure that you're drinking plenty of fluids and making sure you're up moving around like you should be, and taking the stool softeners if needed, because you are taking the pain medications, which also helps constipation. You want to make sure you prevent the constipation from getting worse. So also to prevent pneumonia, you'll be getting a little machine when you come back to the room. It's called an incentive spirometry. Those are to exercise your lungs. Those are to prevent pneumonia from setting in. We want to make sure you cough and deep breathe very often and make sure that you're staying mobile to prevent pneumonia from setting in. Some more complications that we're preventing is bleeding. You may come back to the unit with a drain, something called a hemovac drain, and this just helps keep the blood from forming around your surgical site. It just keeps it away and it keeps it pumped off of your site. We'll also be drawing lab work probably daily while you're here, checking your hemoglobin and your hematocrit levels, which is your blood levels. And when you come through surgery, it's possible if you do not have a history of blood clots or DVTs, you may receive something called tranexamic acid. A big, huge contraindication is if you have a history of blood clots, or if you've had a PE, or if you're on hormone therapy. So those are reasons you may not receive TXA, but if you do not have those in your history, you may receive something called TXA. It helps prevent bleeding. So we definitely value your opinion. I think I mentioned before that whenever you are going through an elective surgery, such as a knee hip replacement or a hip replacement, you are in a program with us. So before, when you came through pre-admission testing, they had you fill out a survey that asked you about how your pain level is now, how your mobility is now, how is it sitting, how is it standing, how is it walking. So you answered that survey for us. We will also be sending you a survey 6 weeks post-op, 12 weeks post-op, and 6 months post-op. And we want to hear back from you. We want to know how the surgery did for you. Did it make it better? Are you better, or are you worse, or are you the same? So we want to hear those. Please send those surveys back. We definitely want to hear from you. You will also be getting an invitation to a quarterly reunion luncheon, and this provides the opportunity for you to share your experience with us. We want to know from point A to point Z how the hospital did for you, how the nurses did for you, how the unit looked, how PACU was for you, how the OR was for you. From point A to Z, we want to know everything that we did right. We want to know everything we did wrong for you. So I really would like for you to think about coming to these reunion lunches, and also send back those surveys. So I am complete with my part, and I will leave you to Jessica. Thank you.
Hello, I'm Jessica, and I'm going to go over the rehab portion of the presentation with you. Physical therapy will begin generally the same day of your surgery. If for some reason your surgery is not scheduled until later in the day, or if your vitals are a little unstable, then your PT eval may be the next morning after surgery. However, if you're generally up to our unit around 2 or 3 p.m. and your vitals are okay, therapy will go ahead and begin. The evaluation will be very general, just getting in and out of bed, walking a little bit, maybe getting into a chair. And as you progress throughout the days you're here, we will work on stairs and attend group therapy. Group therapy is where we will have you come down to the therapy room with others to complete your exercises. That will begin at 1 p.m. the day after your surgery, and it will continue every day after that at 9 a.m. and 1 p.m. We encourage you to have a coach present so they can help you with your exercises and know what to expect when you get home. Some comfortable clothes would be a good idea to bring with you as well for your exercises. Maybe 2 to 3 outfits of loose-fitting t-shirts and shorts, and a comfortable pair of shoes is recommended as well. If you're having a total hip replacement, there are some general precautions that we need you to follow after surgery. Those include: do not flex the hip past 90 degrees, do not cross your legs, and do not twist or turn your toes too far in or too far out. If you are having an anterior approach, you want to make sure the legs do not go out past shoulder width as well. If you're having a knee replacement, there are generally no precautions. We just encourage you to not rest a pillow underneath of your knee. Occupational therapy will begin working with you the day after surgery. They will work with you on bathing, dressing, and hygiene. If you need any assistive device that the OT may recommend, such as a reacher, sock aid, dressing stick, or long-handled shoehorn, those items will be provided to you as well. You may need some equipment once you discharge home from the hospital, such as a rolling walker, a bedside commode, or a shower chair. Generally, these items will require insurance coverage, and some of them may require a copay. We have a case manager on the floor that will help you with all of these items before you discharge. There are some things you can do at home to prepare for your surgery now, and that is ensuring that you have a chair with armrest. A reclining chair is also okay. You just want to make sure it's not too low to the ground. You do not need a special bed at home. You can go ahead and remove throw rugs and ensure that your stairs have a sturdy rail to hold onto when you go up. It's also a good idea to have some extra ice packs on hand for when you come home from the hospital. Most of our patients are going home with home health physical therapy. If you have a good support system and you have done well with your therapy here, our program will generally get you ready to go home upon discharge from the hospital. If you have additional needs or have no one at home with you, then sometimes patients will need to discharge to a skilled nursing facility or subacute rehab. The therapist here will work with you and determine what the safest plan of action is. We encourage having a coach present during your stay here at the hospital so we can teach them how to help you when you go home from surgery. Some of the roles of the caregiver are listed here, and those are to assist with mobility, dressing changes, helping you change those TED stockings, and help with some exercises as well. While you're at home, it is very important to change positions often. Do not sit for more than 1 hour at a time. Make sure you're following those joint precautions. You want to walk daily and steadily, trying to increase your distance each time. And you want to try to limit your stair use to about 2 times a day for the first week you're home. Your homework begins today in preparation for your joint replacement. The basic exercises 1 through 6 are in your guidebook on page 37 to 38. We recommend doing those 2 to 3 times a day until the day of your surgery. With these exercises, complete 10 to 15 repetitions each in a pain-free zone. If anything causes too much pain, go ahead and stop the exercise. The first exercise is ankle pumps. You gently pull your toes back towards your nose and down towards the surface. Do both ankles at the same time or alternate feet. Perform this exercise slowly. The second one is quad sets. For this exercise, you want to slowly tighten your thigh muscle, pushing your knee down into the surface. You want to hold for a count of 10. During this exercise, you should look and feel for the muscle above your knee contracting. Gluteal sets are the next exercise. For this exercise, you want to squeeze your buttocks muscles together as tightly as possible and hold for a count of 10. Hip adduction and adduction. For this exercise, you can modify your position into a semi-reclined position if you are not able to lie flat. You want to slide your leg out to the side and back in. While you're doing this, make sure your kneecap is pointed up towards the ceiling. You are able to do both legs at the same time if you wish. Our next exercise is heel slides. For this exercise, you may want to use a TheraBand to assist with getting a higher bend in your knee. For this exercise, you want to wrap the TheraBand around your foot and pull and bend your knee up while your heel is sliding towards your buttocks, and then straighten back down. Our last exercise is called a short arc quad. For this exercise, you can place a large rolled towel about 8 inches in diameter underneath of your leg. You're going to prop it underneath of your knee. For this exercise, you want to straighten the leg, keeping the knee on the roll, lifting your heel up. Tighten at the top, hold for about 5 seconds, and then lower back down. As you work, you want to try to achieve full extension. Thank you so much for taking the time to watch this presentation. If you have any questions, please give us a call on 4 South at the hospital. We look forward to seeing you soon.